Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying a very short, cute and a very important topic, that is the hypertension. Okay, that is the hypertension. It is one of the most common disorder which is found in our country, right? Hypertension and diabetes, they are so common. Okay, what is hypertension? When you define that the person is having hypertension, if the blood pressure, that is the systolic blood pressure, if it is more than or equal to 140 millimeters of mercury, or the diastolic blood pressure is more than or equal to 90 millimeters of mercury, then you say that the person is having hypertension. Okay, next you have hypertension of two types. What are the two types you have? Primary and the secondary. So in the primary one, there is a no single identifiable cause. There are many causes out for primary. In the secondary one, you have the system wise causes, that is first one renal, then the endocrine, then the cardiovascular, pregnancy and the neurological. Okay, so let's see them one by one. In the renal, you have the chronic kidney disease and the renovascular disease. In the endocrine, you have the Cushing syndrome, the primary hyperaldosteronism and the hypothyroidism. In the cardiovascular, you have the coarctation of aorta, that also we will read. Then in the pregnancy, you have preeclampsia and eclampsia. When you will go to your final year, you will read there about the preeclampsia and the eclampsia. There in gynecology also it is very important. In neurological, you have the raised intracranial pressure. And how will you manage the case of a raised intracranial pressure? You will give that patient mannitol. Okay, let's see the pathogenesis. So there are firstly the genetic predisposition, because there are chances that if your father or if your mother are having hypertension, they are the case of hypertension, then it is likely that you will develop hypertension. Because I remember that my grandmother was having the hypertension, and so gradually my father also developed that disease. Okay, next it is polygenic. The mutation is there in the ion transport, that is the sodium channel, sodium and potassium ATPase. And what is the mnemonic that I have given you? The mnemonic of Nokia, right? So remember the mnemonic of Nokia. Next, what are environmental factor? Maybe the person is consuming a lot amount of salt. Okay, there are some people who just want extra salt in each and everything. Okay, not just on the wounds they put the salt, but on each and every dishes that they eat, they put extra amount of salt. So what happens is, after taking extra amount of salt, extra amount of sodium, there is an increased plasma volume and the peripheral vascular resistance. Then if the person is obese, what happens? There is insulin resistant and sympathetic activation. If the person is having stress, obviously there will be sympathetic overactivity which will be occurring. So the person will the person will develop hypertension. Alcohol, smoking, sedentary lifestyle, the three heroes of each and every disease, right? If you don't know what are the causes of that disease, alcohol, smoking, sedentary lifestyle, they are the common to all the disease, right? Next you have, let's talk about the neurohumoral mechanism that is involved in the hypertension. So first you have is there is increase in the heart rate and contractility. There is increase in the heart rate and the contractility, as a result of which what happens? The cardiac output increases. And after the cardiac output, the peripheral vascular constriction also increase and the peripheral resistance increase. Then what happens is, you have second thing is your renin angiotensin aldosterone system, the RAS system. And I hope you have read that in your physiology chapter as well, because RAS system is very important. Okay, what happens is, there is decrease in the renal perfusion. First there is decrease in the renal perfusion, then there is renin release. After that there is angiotensin 2, which causes the vasoconstriction, which further causes the vasoconstriction. Angiotensin 2 increases the aldosterone, then there is sodium and water retention that the body will demand. There will be sodium and water retention. After that, the angiotensin 2 stimulates the smooth muscles and causes the hypertrophy. We have read about hypertrophy in our journal pathology lectures, right? Hypertrophy and hyperplasia. Then there will be vascular remodeling of all the vessels, right? What are the clinical features? First clinical features is often asymptomatic. In your PSM, you will read about a diagram I will give you. You will read about hypertension in your PSM also. There is a study, okay, like there is a circle diagram which is there in your Park book also. They say that 90% of the people are still undiagnosed. Okay, that is the rule of 10 that you have over there, that half of the people are not diagnosed, and even if they are diagnosed, they are not on the treatment. They are not taking any sort of treatment if they are diagnosed. Okay, so then you will be having the headache. Obviously, if there is increase in the blood pressure, what you are expecting, the person will have a severe headache. Okay, then there will be palpitations. I have already told you what palpitations is. Blurred visions. There will be effect in your retina also. Malignant hypertension leads to severe headache, vomiting, papilledema, renal failure, 𝗵𝗵𝗵𝗵𝗵𝗵. All these are the disorders which are related to your hypertension, right? So it is very important to control hypertension, right? And I have already told you hypertension is a modifiable disease, right? What are the complications of hypertension you have? What are the complications you have? First one is it affects all the organs, right? Either it's a heart, it's brain, kidney, aorta or retina. In the heart, you will have the left ventricular hypertrophy, ischemic heart disease, arrhythmias, irregular rhythms, heart failure. Finally, there will be sudden death. In the brain, the person will have stroke, hypertensive encephalopathy, vascular dementia. We will read about all these disorders in our CNS chapter. In the kidney, the person will have the benign nephrosclerosis. In the aorta, aneurysm. I have already told you what aneurysm is. The bulging of the blood vessels, the ballooning story that we have read. In the retina, the person will have the hypertensive retinopathy, as a result of which there will be visual loss. Okay. Next, what are the investigations you will order? First, the blood pressure. I think you all know how to measure a blood pressure. How you will measure a blood pressure? You will take the machine, right? Then you will put the cuff above the Q vital fossa. You will put the cuff. Then here you will feel the pulses. After that, you will put your stethoscope over here. Then the first heart sound that is heard is your systolic one, and the second heart sound that is heard, the heart sound when it stops, it's your diastolic one. Okay, so this is basically the method by which you measure the blood pressure. Okay, second you will order is the urine examination to see if the patient is having the proteinuria and the microscopic hematuria. Then you will order the renal function test, because the hypertension was targeting that organ also. In the ECG, you will see there is evidence of left ventricular hypertrophy and arrhythmias that you are able to see. In the fundoscopy is for your eyes. You will be able to see the retinal changes. What is the management? First one, I have already told you, you have to do the lifestyle modification. That is the salt restriction, weight reduction, regular exercise. Then avoid alcohol, smoking, and avoid stress. Take as much. Don't take as much, okay? Don't take that much of stress in your life that you are not able to enjoy your life properly, okay? See, your life is so much important than these exams. So don't take any stress, okay? Be stress-free. Everything will fall into place one day, okay? Second are drugs. There you have the diuretics that are your thiazides and loop diuretic. Beta blockers you will give to reduce the heart rate and to reduce the renin secretion. Then you will give the calcium channel blockers. What are the calcium channel blockers? Nifedipine, right? Then you will give the ACE inhibitors and ARBs. They block the RAS system. They block the RAS system. Okay, so this was all about this chapter. I hope I made this chapter very clear. See, it's very important to treat hypertension because it is one of the most leading cause in our country, right? Every 3 out of every 1 person is having hypertension, so it is very important to treat this disease. And this was all about the chapter. I hope I made myself very clear. If you are having any sort of doubt, you are free to DM me, you are free to ask me anywhere. Okay, thank you so much.